Two JAMA studies, spanning over 30,000 person-years of follow-up, found that ejaculation frequency is independently associated with prostate cancer risk. Men ejaculating 21 or more times per month showed a 31% reduction in prostate cancer risk compared to those ejaculating 4 to 7 times monthly. This is not a contested finding. It has been replicated across two independent Harvard cohorts. The relationship between sexual activity, testosterone levels, and long-term health is more complex, better documented, and more consequential than most people told. Ryder et al.'s 2016 European Urology paper updated and extended Leitzman's original JAMA findings with an additional 10 years of follow-up in the health professionals' follow-up study. The association between high ejaculation frequency and reduced prostate cancer risk was consistent, stronger for low-grade disease, and independent of known confounders. The mechanism involves reduction of intraluminal prostatic secretion stases and clearance of carcinogenic secretions. This video draws from 5 peer-reviewed studies across JAMA, European Urology, Journal of Endocrinology, Biological Psychology, and Journal of Sexual Medicine, covering ejaculation frequency and prostate cancer risk, testosterone and sexual behavior, and the broader health effects of sexual activity. Online discourse about sexual health frequently presents testosterone management and ejaculation frequency as a zero-sum trade-off, with claims that abstinence raises testosterone or that frequent ejaculation depletes it. The peer-reviewed evidence does not support this framing. Exton et al.'s neuroendocrine research showed that sexual activity produces acute testosterone surges, and that the relationship between testosterone and sexual behavior is bidirectional. Testosterone drives libido, and sexual activity also stimulates testosterone production. Prostate cancer is the second most common cancer in American men, with approximately 288,000 new cases and 34,000 deaths annually. Leitzman et al.'s 2004 JAMA study, analyzing 29,342 men over 8 years in the health professionals follow-up study, found a significant inverse association between ejaculation frequency and prostate cancer that was not explained by sexual transmission of cancer-causing infections, socioeconomic status, or other potential confounders. Testosterone decline and sexual dysfunction are often treated as separate problems with separate solutions. Corona et al.'s 2010 Journal of Sexual Medicine review of randomized controlled trials established that testosterone is a bidirectional variable. Low T reduces sexual desire and performance, while sexual inactivity further reduces T through disuse mechanisms. Sexual health and hormonal health are not separable. Leitzman et al.'s 2004 JAMA study was the first large-scale prospective analysis of ejaculation frequency and prostate cancer risk with sufficient statistical power to produce reliable risk estimates. The study analyzed health professionals' follow-up study data from 29,342 men, documenting ejaculation frequency across multiple age groups and tracking prostate cancer incidence over 8 years. Sexual activity and testosterone interact through acute hormonal responses. Exton et al.'s Journal of Endocrinology research showed that viewing sexual stimuli and engaging in sexual intercourse both produce measurable testosterone surges in men. This acute response is distinct from baseline testosterone levels and suggests an active feedback loop between sexual behavior and androgen production. Multiple factors influence the testosterone-sexual health relationship. Research allows a ranking of the interventions with the strongest evidence for maintaining both hormonal and sexual health over the lifespan. Testosterone and sexual health interact through a cascade of hormonal signals, behavioral feedback, and metabolic factors. Understanding this system reveals why treating low libido or sexual dysfunction in isolation, without addressing the hormonal root causes, produces poor results. The evidence-based testosterone and sexual health optimization framework addresses 4 modifiable variables: sleep, body composition, exercise, and nutritional deficiencies. The research data does not support abstinence-based testosterone optimization. It supports a lifestyle that maintains hormonal and sexual health simultaneously. Testosterone and sexual health optimization follows a predictable timeline when the full framework is applied consistently. The fastest responding variable is sleep. The slowest is body composition. The daily implementation of a testosterone and sexual health protocol is built around 6 consistent actions targeting sleep, nutrition, training, and hormonal monitoring. Testosterone and sexual health optimization must be personalized based on clinical context, age, and measured hormone levels. These adjustments match the protocol to the individual situation. The evidence on testosterone, sexual health, and ejaculation frequency is more consistent and clinically meaningful than popular discourse suggests. Here is what the science shows. The evidence is clear. The mechanisms are understood. and the steps to optimize both testosterone and long-term sexual health are within reach for anyone who acts on the actual science. Follow MedBrief today for more science-backed health insights, explained clearly.